Hey, Aisha, you ready?
I'm ready.
Okay, great. All right, hold on one second. I gotta, actually start the hearing. All right. Good afternoon. I'd like to call this roundtable to order. Today is Tuesday, February 25th, 2025. The time is 2:01 p.m. We're in room 120 of the John A. Wilson Building, as well as on the Zoom virtual platform. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today, we will hear from one nominee to the Interstate Medical Licensure Compact Commission. The Interstate Medical Licensure Compact Commission is a multi-state regulatory body that oversees the Interstate Medical Licensure Compact, which is an agreement among participating U.S. states, territories to streamline the medical license process across state lines. The compact provides an expedited pathway for qualified physicians to obtain licenses in multiple jurisdictions, improving healthcare access, particularly in underserved areas, as well as facilitating the expansion of telemedicine. The Commission is responsible for administering the compact, ensuring compliance among member states, and maintaining standards for physician eligibility and licensure portability. Each member state or jurisdiction is allowed to appoint 2 commissioners to participate in the Commission's decision-making and oversight activities. PR 26-30 nominates Aisha Nixon to the Interstate Medical Licensure Compact Commission for appointment as a voting member. Ms. Nixon is a health professional with over 15 years, giving her more experience than she has, with over 15 years of experience in public health and health administration. She's currently the Associate Director of the Office of Professional Licensing Boards at DC Health. She holds a Master's of Public Health degree from George Washington University and has served in several various leadership roles within DC's Department of Health, focusing on policy development and program management. Ms. Nixon has been instrumental in implementing initiatives aimed at improving healthcare access and quality for underserved populations in DC, and she is a Ward 7 resident. I don't have any of my colleagues who are here, so I'm going to call up Ms. Nixon for her testimony. Before you begin, I have to swear you in, so if you could raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia in this committee is the truth, the whole truth, and nothing but the truth?
I do.
Wonderful. All right, when you're ready.
Good afternoon, Councilperson Henderson and members of the committee. I am Aisha Nixon, and it is my pleasure to appear before you today as you consider my nomination to serve as Commissioner for the Interstate Medical Licensure Compact on behalf of the District of Columbia. I am grateful to Mayor Mariel Bowser for nominating me and honored by the opportunity to serve the residents of the district in this capacity. As a longtime resident of the District of Columbia, I have had the privilege of immersing myself in the vibrant culture and community of this great city. My personal and professional experiences have fueled my passion for public service and my commitment to advancing healthcare access and regulation. The Interstate Medical Licensure Compact Commission, the IMLCC, plays a critical role in administering the Compact's rules, policies, and procedures. It ensures seamless information exchange between participating states, manages data collection for physician applications and licensures, and facilitates the transfer of administrative and licensure fees between the states. The Commission is governed by bylaws that provide the framework for its operations and upholding transparency, independence, and accountability. As a commissioner, I have had the privilege of serving on the Budget Committee, which is responsible for collaborating with the IMLCC staff to develop the annual budget. We work diligently to ensure transparency and accountability in the management and reporting of the IMLCC budget, aligning with the Commission's mission and operational goals. As part of the commission, I would also have the privilege of working with representatives from participating states to further enhance the compact's operations while supporting the needs of healthcare professionals and state licensing boards. Currently, I serve as the Associate Director for the Office of Health Professional Licensing Boards at the DC Department of Health. I oversee 17 health professional boards, regulating over 72 professions and approximately 100,000 healthcare professionals. Additionally, I manage 3 programs, including a practitioner health program, all focused on safeguarding the health and safety of district residents. My journey at DC Health began in 2014 as a health licensing specialist. Over the years, I have served as the executive director and now as the associate director. With over a decade of clinical and administrative experience, my career has been firmly rooted in healthcare. These roles have deepened my understanding of the regulatory process and strengthened my commitment to fostering trust between healthcare providers, regulatory bodies, and the community we serve. If confirmed, I look forward to contributing my regulatory experience, leadership skills, and passion for public service to advance the mission of the Interstate Medical Licensure Compact Commission. Thank you, Chairperson Henderson, for the opportunity to testify before you today. I'm happy to respond to any questions from you or other members of the committee.
Thank you, Ms. Nixon, and thank you for your willingness to serve. I'm gonna do the PSA that I do for all of your other boards and commission nominees later, but it's always good to have folks who want to step into additional roles and on behalf of district residents. So I do have a couple of questions just to clarify some things. So first, our understanding is that you were appointed to the commission in July of 2023 and that you currently serve on the budget committee. However, this nomination states that you're filling a vacant seat previously held by Frank Myers. Are you being reappointed or is this a separate seat?
It's a separate seat, would be my understanding.
Okay. So the commission allows for 2 representatives from each of the member jurisdiction. Can you confirm whether or not the other DC seat is filled or vacant?
It is currently vacant
It's
and it's
currently
being worked on, yes.
okay. All right. So in your testimony, you mentioned serving on the budget committee and working with representatives from participating compact states on operations. Can you elaborate on some of the specific responsibilities involved in that? I imagine that working with a variety of other jurisdictions can sometimes be a beautiful exercise in restraint and cooperation.
No, it's been actually a great experience with especially being assigned to the budget committee. At first, when I was told I was going to be assigned to the budget committee, I was kind of like, me and numbers, not really my thing. But it's been a really good experience in the sense of just working with the IMLCC staff to ensure that the budget that is in place will help the commission accomplish all of their goals and be able to bring in new initiatives. So some of the things is like ensuring that they have the funding available and it being allocated to the right contracting companies related to uh, like an API system currently that they just finished actually doing beta testing and it is now live. So things like that's been part of the good part of it. I think the member states or jurisdictions, they're good with just asking questions and clarity. Again, a large part of the budget goes to the vendor that provides and supports the usage of credit cards or electronic payments. And so that's a big thing. So, being able to answer questions on like, what is this line item? So again, it's been a good experience.
That's good. That's good to hear. Um, Now, just for clarity on our side, do you know how many district residents participate in the compact?
Yes, I do have those numbers. So currently, there are 700 and it's 857 total active IMLCC license holders in the District of Columbia. And it's
Okay.
broken down. So how they have it broken down is MDs, and then DOs, so medicine and surgery and osteopathy and surgery.
Okay. Um, that's like less than I thought that there would be. Um, especially given the number of people who continuously bang down our doors to say, we need more compacts, we need more compacts. This exists for, medical. Um, is it a question of us not doing the proper promotion on our side or folks just not interested in sort of the additional paperwork necessary?
So everything is done through the IMLCC. So individuals or physicians who are interested in participating, they would go directly to their site and apply through that process. And then based on where their state of principal licenses is, they'll kind of check off what states they want to hold a license in. I think some of the things or why you see there's a little bit of a difference is because DC is just unique in the sense of where we are, and we have our neighboring jurisdictions between Maryland and with Virginia. Currently, Virginia does not have the medical licensure compact for
Interesting.
medicine, so it's only Maryland. Um, and so I think that also kind of plays a part is like if the states around you are not part of the compact, sometimes it may not be of benefit to it.
That is
And then
correct.
we also
That's
have, so that's one of the reasons why at least for our physicians, and now we're working on it for our physician assistants, we were able to create um, our reciprocity agreement between DC, Maryland, and Virginia. And we still see that individuals apply through this pathway as well.
okay. In that regard, as a commissioner, I guess you would see information around whether or not someone has either submitted certain number of complaints about someone in the compact, or if there are residents who submitted complaints themselves. Um, has there been any feedback that you have received from licensed physicians who are part of the compact in terms of if it is done well in sort of expanding the professional opportunities, et cetera?
So no, I haven't received any feedback. We haven't received any feedback. I know that the IMLCC, there has been research, and they are doing research based on if there's a demonstration of growth within based on having the compact. I think for me, a lot of times when you think about compact, I don't think it demonstrates growth in numbers because again, if there's only 100,000 doctors in the whole country, it's 100,000 doctors that will be spread apart. I think, when you think about it's like that's about capacity, a
Hmm.
capacity building. So not necessarily complaints about the process or any issues. I feel like that's kind of the only complaint that I think that the IMLCC is addressing with was about uh, providers, the physicians having to manage all of the various licenses. So again, creating a system for the professionals that houses all of their information, all of the licenses
In
that
one
they
spot.
have are held in one space. And so that's kind of been the biggest question or biggest complaint um, from my understanding to the commission regarding the process for applicants.
Got it. Since serving on the commission, you and I, you and the committee, DC Health and the committee, we've had lots of conversations about compacts. We've had a lot of other social work, nurses, dentists, occupational therapy. Everybody wants a compact. Um, After having served as a commissioner for the past 2 years, has your views about the value of compacts changed in any way?
Not personally. I think that compacts serve a purpose, but I think it goes back to it being the right fit, the compact being the right fit for said jurisdiction. There are a number of compacts, like you stated. All compacts are not designed the same. And so, like for me, being on the committee for the IMLCC, like I see the value in it and how it allows the membering states to still have their autonomy and make decisions related to the licensure process in the District of Columbia. Whereas other compacts may not have, we won't have that ability to still have the autonomy. It'll be more so like, hey, this is, it's easy for the licensee, but I don't know if it demonstrates a change. I'll use the other compact. So we're part of SciPac, which is the psychology compact. I don't know if it's demonstrated that there's been an increase of psychologists in the District of Columbia. I know most of them utilize the e-passport, which is them having the ability to practice telehealth. while being a compact holder. But again, I don't know if it's increased the access to behavioral health care in the district with us participating. So I think it really varies.
Yeah, I think you are sort of spot on there of we shouldn't necessarily be pursuing or entering compacts just to say that we did, but that there should be actually some value add or benefit to the jurisdiction to join that.
Yeah.
Okay. How often does the commission meet?
So, for being on the budget committee, we meet 6 times a year, and then the entire group, they have monthly calls. So just kind of giving updates about what's going on, any new things, and then there's an annual meeting.
Okay. And do you feel as though you have the time commitment to be able to serve the district effectively on this body?
Yes.
Great. All right. I don't have any further questions. Is there anything you wanted to add that I hadn't asked you?
Yep.
Awesome. All right. Well, this concludes today's roundtable. I want to thank you again, Ms. Nixon, for your willingness to serve as a representative for the district. This is my PSA spot for those who are watching at home. Volunteering for a mayoral board or commission is an excellent way to give back to the district and to inform policy and programmatic decisions. You can even serve on commissions or boards in this way, where you're representing the entire District of Columbia amongst other states and jurisdictions. The committee will hold its next meeting today at 3 o'clock. We're going to vote on this nomination. And thank you, Ms. Nixon. The time is 2:17 p.m. and this roundtable is adjourned.
Thank you.